Hi, everybody. Welcome to another awesome episode of the Beauty Outlaw. And today's a special episode for me because I'm bringing you home. I'm bringing you into my home with my staff and the people I adore and work for. And these are nurses, future nurses, and an undecided nurse. So we're going to go behind their thoughts of aesthetics, why they're getting into it, the trends in aesthetics, what made them or inspired them to get into aesthetics. But first, I want to bring you the most important thing that keeps this going is you liking and subscribing, as well as my sponsor. So my sponsor today is HealMD, and we're so thankful for them. They were actually on a podcast prior. HealMD's commitment to quality is unwavering. They pride themselves on supplying products that undergo rigorous lab testing with a focus on holistic medicine, having products that are gluten-free, cruelty-free, and non-GMO. I've been using HealMD in my clinic long before they became my sponsor. Their medical-grade CBD truly delivers, whether the patient needs stress relief, help with recovery, pain, or sleep. Plus, they're innovative in treatments and skincare advancements align with my values on skin. They are a game changer in the world of aesthetics. Every aesthetic practice should have these products to help their patients. I highly recommend them and checking them out. Go to their website and reach out to them and they will get you set up right. HealMD, I love them. So when I brought you guys into the beginning of the podcast, I said I was bringing you home to my group here and my staff, and some of them are nurses already, gonna be nurses and undecided. So I'd like to introduce you first to Lauren. Lauren is an ICU nurse currently. That's her full-time job. And she also works here. She's an injector and honing her craft. And tell us a little bit, Lauren, about where you grew up. I want to know everything because, I want to get the background. Everybody needs to know you. Tell us a little bit about your life story and what got you into nursing in the first place.
Okay. I was born and raised in Rancho Santa Margarita.
And that's here in California.
Yeah, right down the street. My whole education is on Oso Parkway. I went to Wagon Wheel, Los Flores, and Tesoro High School. A little bit about me, I would say since I was probably 5 or 6, I wanted to be a nurse. I'd always had this little medical bag. I was always playing doctor. I always had Band-Aids on. I always asked why. So if something happened to a loved one or just anyone, I'd always ask my mom, but mommy, why? Are they okay? Why do they have that? So I've always been so interested. And then after high school, school was always challenging for me growing up. I later found out when I was 18 that I had ADD, but I think the best thing for me was not getting that diagnosis at a younger age because I feel like it would have maybe hindered what I could accomplish. So I went to undergrad school at Santa Barbara City College, and I was studying psychology. I was there for 2 years. I did good. And then I went to Concordia University. It's a Christian college here. And I had a psych degree, graduated with my bachelor's in psychology. And then I always had nursing in my mind. It never, it was always there. I always knew at some point in my life I'd become a nurse, but I was very intimidated by it because of the schooling. So I was like, oh, maybe I could do occupational therapy. And then that didn't work out. I didn't pursue it. My sister actually gave birth to my nephew, Luke. And it was in that moment after I graduated, I was like, Mom, I need to go back to school for nursing. And at that time I was 24. So 25, I did an accelerated nursing program and I got my bachelor's in nursing. And then my first job was at PIH Whittier. I was an oncology nurse. I did that for 6 months. And then I had an opportunity at Mission Hospital, and I've been working, it's telemetry sepsis, on the sepsis ward for the last 3.5 years. And now...
You were there during COVID.
I was there during COVID.
Well, I think you were in LA in COVID.
I was in the start of COVID. I was in oncology, so we didn't have COVID patients. It was a very protected unit. And then when I got my job at Mission, I was in the COVID ward, and it was still 20, 21, 22. So it still peak. It was still bad.
Yeah.
Definitely life-changing. Something I never want to relive. But while I was a nurse, I was also getting my lashes done here. And I was...
By Christy, our amazing lash artist here. She's amazing.
And I was admiring you and what you do. And you are the true reason of what inspired me to be in aesthetics.
That's super sweet.
It's true.
That you say that. Lauren came on. You were very inquisitive. Many questions. She'd come in to get her eyelashes done. And what I really admired about you was that you had that foundation as a nurse, working in the floor, treating patients. And I feel like that's what gave me the feeling that I wanted to take you under my wing a bit and get you in here and get you started. And what was the next step? What did we do? I think I
got certified in October. I took a course with you. And then
a neuromodulator.
Yes.
On Botox.
And then I came in still and observed you a lot. And then when I felt like I was ready, I reached out to you.
You went off and you worked.
I worked at a different med spa. And it was a good experience. I just didn't feel like I could grow there. And I kind of brought that up to you because here I feel like the opportunities are endless and just everything you do is amazing. So
You're like an advertisement here for JK.
It's true, though. Everyone that comes in this place leaves so happy.
Yeah, we're fortunate that we're able to really heal people and make them beautiful from the inside out. I think that's what we all share here together, this amazing unity of love and compassion for our patients.
Right.
And you have that. And that's why we love having you here. And you're growing right before my very eyes. I'm so excited to watch you blossom and just go crazy, get into all things aesthetics. So we're going to get back at you. I'm going to go to my next little wonderful little person here. I'm going to do a small intro on Charlotte. Charlotte has been with me 2.5 years. She was very young at the time. She's going to be 22 now, but she was much younger and didn't know what she wanted to do. And she was a patient of mine. And I'm going to let her share the rest of her story. But Charlotte has been accepted to one of the most prestigious schools. In fact, I think they just got voted #1 nursing school, either in NCLEX acceptance or passing rate. It's a very hard school to get into. If people have tried to get into hard med schools, this is a very hard nursing school to get into. So I'm so proud of you for that.
Thank you.
But we're going to start way back with you too, Charlotte.
Okay.
I know it's not that long ago for me, but it is for you. So share it.
Okay. So I feel like originally going into school, I always wanted to go into veterinary medicine. I've always had a huge love for animals. I've always wanted to help animals and have a bunch of animals. But, you know, going through life, I always had really bad acne. And it kind of fluctuated through life. I feel like there were times where my skin was really good, times where my skin was really bad. And finally, I was like, at a point, I had tried everything. And I know everyone says that. They're like, well, I've tried everything. But at this point, it had felt like that. I was like, okay, well, there's nothing else I can do besides go on Accutane. And that was really the last thing that I wanted to do. And so I was living with one of my mom's friends who actually works here, Lindsay. Shout out to Lindsay.
Hi, Lindsay.
And she had recommended you because, you know, she had connections to Christy and her daughter, you know, had huge success with you. And I was like, well, I've tried everything now. Like, is it really going to help? You know, like, I know Accutane will just like knock it out and, you know, knock all my other organs out with it. But so,
just kidding.
Just kidding. So it was just my personal preference. I just didn't want to, you know, I had heard, you know, things that were negative about Accutane, and it was just something that I, you know, didn't
last resort.
It was a last resort. And so I finally was like, okay, I'm just going to do it. I'm going to send it in there. And, you know, at first I was like, okay, well, I'll just give it like 2 months. I'll give it 2 months. And
she's deciding she is the provider now.
Right.
She's going to give it to
exactly. So I was like, if it's not, that's how like serious I was about, being at my wit's end with it. And, it's so detrimental too. Not just physically. I mean, it's your face. You don't, it's you
First thing people see.
Yeah. Mm-hmm. It's not only that, but it's how you feel mentally. It's, you don't want to go anywhere. Your makeup doesn't sit right on your face. And you just feel like that's the only thing everyone's looking at. So I came in, we did our first treatment, and I was like, okay, wow, I think I like her. She's pretty cool. I think you had your pink hair at that time too. I was like, I like her. And then, a couple months go by and I'm seeing huge progress, and it's helped so much with how I feel. And, it still wasn't, completely gone at that point because it's a journey.
Yeah.
I mean, it's not something that, even to this day, you get a hormonal breakout or something because there's no cure for it. So finally after, I want to say 3 months, I feel like in recovery at that point, and we were kind of maintaining, and I was so happy. And, ever since then, I've just been on your program. I still beg you for treatments to this day.
I know you do.
I mean, with your packed schedule. So yeah, I feel like that was, my journey with acne. And, I was working at a veterinary hospital, and I was getting experience there, and I had signed up for Saddleback courses to be in business because I still kind of was unsure of what I wanted to do. I didn't know if I wanted to fully go into, veterinary medicine at that point. And after working at the vet for a little while, I realized that it wasn't something that I wanted to do. And I thought that I could help animals.
You wanted to have animals. You didn't want to treat animals.
Yes.
Or help heal them.
Yes. And, it was kind of sad because at a certain point, I feel like I got almost just desensitized to, animals being euthanized, and, seeing those things. It's heart-wrenching. I mean, I would have to go in the back and cry because it was so hard to watch that. And then eventually I was like, seeing it all the time, you don't have those same emotions towards it. And that was really hard for me. I was like, I don't want to feel this way. And, it's day in and day out, you see these animals for, their regular checkups. And I was building connections with, the animals. And that's really what I wanted. I wanted the connection with those animals, and to have them, I wanted to keep them all and take them all home.
And heal their hearts.
Exactly. Yeah.
Their hearts.
So then I was like, okay, what's my next step? So I decided to finish my business associates at Saddleback. And, once I finished that, I had already been seeing Jerry, and I, really took a long thought about what I wanted to do. And I was like, I had heard someone say something that you've struggled with most in your life is actually something that you can build a career out of. And I was like, okay, it was something that I've really struggled with has been acne, that's something that has been huge in my life. And, my family knows that it is something that I even obsess over because it's so hard not to. And so I was like, okay, I want to talk to Jerry, and just like next time I have a treatment with her, I'm just going to throw it out there and see what she thinks. And she, really guided me through what the school of nursing looks like, and, what I could do even just as an esthetician, and kind of guided me through that. And I was like, okay, I think I want to be an esthetician. Like, I think that's something that I want to do.
That's right. This is going back to the first bit of skincare, esthetician.
Yeah. So I was like, I think I can make a big difference, with people's skin and doing that. And then, if a little while went by and I was looking into esthetician schools to go to, and, I was like, you know what? I think that I could do more as a nurse. And, I love that the esthetician school gives you like a foundation in skin. And that's like even why now I would love to go to esthetician school. But I thought, maybe that there's like even a further place that I can go for these patients and do more for them with nursing school. So I decided to look into it, and I decided that Saddleback had a really good nursing program. And so I was like, my heart is set on this place, and I want to go there. Like, I'm going to go there. And it's a really challenging program. And so I started my prerequisites. I started with anatomy, and I was like, whoa, this is a lot. I was like, at first I was like, there's no way I'm capable of doing these classes. This is crazy. But after I started doing it, I was like, wow, I can actually maybe learn a lot, and I can actually do this. And so then I moved on to physiology, and then microbiology, and then I got my certified nursing assistant license. And after I did that, I was like, okay, we're good. I think I can handle this. Maybe. But so then I applied to Saddleback's nursing program a few months ago, and I got in, and I was kind of stunned. I was like, oh, this is real now.
I wasn't.
So I was so happy about that. And so I start January 13th, in case anybody wants to know. But
2025.
Yep. So it's a 2-year program. That's all I have planned out as of right now. But I do see myself in aesthetics long term and being able to help people with their skin and, all the Botox and filler. That's all just icing on the cake. And but I definitely think that my passion for it is to go into skin and to do that. So
I would agree.
Exciting.
I won't try to give my advice too much. I know I do that a lot, but I can see that for you. Thank you, Charlotte. And we're going to come back to some more questions I have for you. So now we're going on to the baby of the bunch. Hi, everybody. This episode is sponsored by Pretty Girl Cosmeceuticals. These products are the best. If you're not using them, you need to use them. You can contact JKH Aesthetics anytime, and we will give you a consultation about how to use these amazing products. We have Glow Girl and Ice Drops. These will keep you young, healthy, and glowing every day of the week. And now, back to the episode. So, she's so cute. Okay, so Leslie came to us through an ad. Charlotte needed some help around here. So Charlotte put up an ad, and this sweet girl, we had several of them come in, but you were noticed by all of us. So we brought you in for an interview, and Charlotte interviewed you, and you were graduating from a school here in California, UCI, which I think a lot of people know. It's a very prestigious university here in Irvine, and you were graduating with your public health and science degree. And this past May, I believe you graduated, and you wanted to be a physician's assistant. That was your goal, and I think that's an amazing goal. We got you in here, though, and us nurses have a way of trying to transition people. We love our physician's assistants, but we love working with you guys too, but we were trying to pull her in maybe a different direction. But what we're going to do is I'm going to let you start with your story. Where did you grow up? What was your journey into college? How did that look? And where are you at right now with your mindset?
Okay.
And what do you do here and what you do here?
Okay.
So talk about it all.
So I grew up in Paramount, California. So it's LA area. Growing up, I never really knew what I wanted to be. I wasn't like the best at school growing up. It was, school was not my thing.
Yeah.
My mom had to put me like in tutoring services and stuff, but still wasn't my strong suit. And then I think one subject that I like really just always had fun in was science. And I knew I always wanted to do something in science. Wasn't really sure of what, but just knew something in that career or with that, like, yeah.
Yeah.
So, I think there was like a time where I thought I wanted to maybe do engineering because of how much I loved science, and it was kind of like just my strong suit in school.
There are people listening right now going, this girl said she's not good at school, but she's really good at science.
No, but like
nurses and doctors are.
Yeah.
So I'll let you keep going.
Like I had fun in it, but I feel like I wasn't too good in it. And so going into high school, my mom put me in this like summer engineering course to see if that's what I wanted to do. And I realized I kind of it wasn't really for me. I was like, let me explore other careers. And so at the time, I used to babysit a lot, as well as there was a time where I was taking care of my grandparents because they were coming to an age where they just always needed someone with them. So I was helping them use the restroom, shower, give them medications. And it kind of helped me realize I really like taking care of people and just being there for people in their weakest moments. And yeah.
It's beautiful.
So I think at this time I was probably graduating high school already, going into college. I got into UCI. I was an undecided major at first. I went in thinking I was going to be a bio major, but I had taken a public health course and I really enjoyed that class. So that's when I decided to do public health. And since I liked taking care of people and science, I started thinking about healthcare. But at the time, I think the only career I really knew about was being a doctor. And well, I'm a first generation college student, so I just didn't know much where to go. And I was like, oh, I don't like the sound of going to school for that long, if I'm being honest. And then I found out about PA, and I joined this PA club at UCI, and I was like, okay, I really like this career.
It's a fit.
Yeah, I could see myself doing this. I met a lot of PAs through this club, and I just, throughout my whole time at UCI, I was like, okay, I think I'm going to do PA. But then as I started coming towards my last year, I don't know where the switch started happening, but I was like, I kind of like the sound of nursing because I really like that patient care aspect of healthcare. And as a PA, I feel like it's more diagnosing, and I just knew I wanted to be more
the hands-on.
Yeah, the hands-on, grow those connections with patients. And so my first job into the healthcare was as a physical therapist aide. And through that job, I really learned that I just love helping patients and getting to know them as more than a patient, but also just know them as a person and
advocate for them.
Yeah,
advocacy,
exactly.
Which is what nursing is so amazing for, is their advocacy. And I think that's what you're seeing in yourself, is being a voice for them.
Yes, exactly.
And a nurturer to take them along the way.
Yeah. And so then as a PA, you do need to complete a certain amount of hours. So at this point, I was still pre-PA. So I was getting my certificate as a medical assistant. And so once I was almost done with that, that's when I started looking for medical assisting jobs. And I came across this job as well as other jobs. But a lot of jobs weren't really willing to work as with my student schedule, or it just really wasn't a fit for me. And I came into here, and second I walked in, I was first of all just in love with the place. And then I meet the people behind this place, and I just loved everyone's personalities and the environment that I was walking into. And then after my interview, I received a call to come back, and I heard I was going to meet you. I was a little nervous. I thought I wasn't sure where it was going to go, and it was a fit, and here I am now.
And here she is.
And so now I'm working on my prereqs I'm leaning towards nursing. Just as everything I said, I really just want the patient care aspect. And I've been getting a lot of questions answered by you, and just clarity of if nursing is really for me. And so far, I think nursing is...
We might have converted someone.
I think
we will love you either way you go, and we will support you either way you go. Because I think you laid that out perfectly. I think PAs listening to this will agree. There is quite a difference between how you're caring for a patient. As a PA, you're diagnosing, you're getting some intake, you're helping them through a acute situation, and helping them get better through medicinal or medications. You're not tending to see them or follow up with them or advocate for them through a journey. So it sounds to me like that's where you might be headed.
Yes.
But either way, we will support you. And we love having you here. And we love our team here. And these three, especially these two, really support me. Charlotte and Leslie, they are my backbone in the back office. They keep me on point and keep my my day on schedule and make my patients very happy. In fact, I think most of them are excited about maybe me passing the torch off. They're like, when is Charlotte going to be a nurse and we can start seeing Charlotte? So that's how much I care and love all about you guys. And I'm glad you shared your stories because they're very impactful to the audience. We're going to have people listening to this that are going through that same journey all of you went through. And if they can identify with your history of how this grew, maybe it'll give them some awareness of what pathway they would like to take through medicine. We're going to move on to aesthetics, the world of aesthetics, injectables, and I feel this is a really good question for all three of you guys to answer. Being here, working now in this field, first jobs, everybody, for their aesthetic, well, second job for you. How close aligned is what you see on social media measure up to what legitimately happens in an office? Charlotte, we'll start with you.
I think that it just depends on the provider. I think it depends per med spa. I think that social media, there's two sides of it. I think that it glorifies a lot of things. It shows the highlight reels of everything. Outside of aesthetics, it shows the highlight reels of just people's lives. And I don't necessarily think that that's a bad thing, but I think that it's also important to show that it's still medicine. It's you still have patients' lives in your hands, and I think that that's always important to remember because it's not always rainbows and sunshine and butterflies. But as much as it is, it truly is an incredible career and an incredible industry. I think that it's just important to remember that it's not always easy. It is hard. It is a challenging career. But I think that it's very rewarding. And I think being able to see patients walk out of here and be more full of light than they were before they walked in is pretty special. And they're I was talking to Lauren about this, but it's just they're choosing to walk in here. I feel like in the hospitals they're more likely than not choosing to be there. And so I think that that's pretty incredible that you get to help somebody in a kind of a different way and make them feel really good and inside and out.
Yep. Do you think that is the attraction? We're going to speak to Lauren because now she's had the years of working in the hospital with patients that are not well.
Right.
And other providers that are on the fence, either trying to find something else to do because that's sometimes too much. What are you seeing? Are you seeing a kind of an exit to this world of aesthetics, or how is that going in your field with other nurses?
I feel like it's definitely a topic that is more talked about like within the nursing station. I think it's just it's with aesthetics. I think the best thing I will say about being a nurse, or the best thing I ever did, was work bedside for 4 years, because I really built my confidence in my assessments, getting to know my patients. And while it's so different here or in aesthetics, it's still such like a foundation that you need to have. So I definitely feel like more nurses and doctors, I think burnout is really real.
Yeah.
And I think that is the beauty about nursing, is that the opportunities are endless. You don't have to be at bedside. You don't have to be burnt out. You don't have to be sad. It's just it's such an important part of nursing and aesthetics, because you have people that they might not be like critically ill, but they have these imperfections that they want help with. And it's pretty cool just as a nurse to be able to provide that for them.
Mm-hmm.
And also, I feel like people come in with like social media, they have certain expectations that just aren't realistic for them. And I think as a nurse, you are an educator and you have to advocate like what's realistic for their treatment plan. So that's one thing with social media that I think is amazing. But I feel like so many people come in and they expect just based off a reel they saw, just one clip of before and after. But it's a journey.
Mm-hmm. It's a journey.
Mm-hmm.
It definitely, I feel it is.
Yes.
Leslie, what do you think? Because you are the newest one to enter into this realm.
Mhm.
And you guys are at the age where you're very active on social media. It's what you guys grew up with. What do you think? Do you think that spoke to you when you were thinking of getting into the world of aesthetics? Was it social media?
Yeah, so I feel like social media does very glamorize the fields, and there's also a healthcare side of it that social media doesn't show. So people just come in thinking like, oh, it's just, I don't know, like Botox or something. But coming here, I've learned that it's so much more, and there could be maybe complications, and that's something I never really knew. I thought it was just, oh, you're gonna be beautiful. Yeah.
Super easy. Go in.
Super easy.
Doesn't matter who's doing it. Get the cheapest price that's marketed, and they will inject it, and you will be fine and beautiful and feel better on the other side. And I think a lot of that's true. I think majority of that is true. People do feel better after their neuromodulator or their treatment. But who was providing it for them? Was there a side effect that the person knew how to handle? There's a lot behind that. It's a medicine.
Yes.
And we have the privilege, we are not physicians. We that's another thing, is nurses and physician's assistants are not, they practice at the oversight of their medical provider, allowing them this grace, as long as they're educated and trained, to perform these procedures. And I think we're seeing the problem with this industry is I think we're seeing some of that bypassed, and people taking this for granted. It makes a lot of money. You can get in and out, but they're not realizing that your health, you have a huge responsibility for patient treatment and care, and there's a lot involved. Complications. Do you see that a lot on social media?
No.
If we did, before you all started working here, actually probably since in the last year or so, how much did you know that somebody could have a complication from injectables?
I didn't know.
Yeah. Not much.
Not much. You hear about it, but you weren't seeing it. So it was like I'd like come up with this own picture in my head of what a complication was, but then actually seeing what they are, it's completely different because they don't show it to us. It's just talked about.
It's talked about.
Yeah.
They're real. It's the side effect. If we go do like a pharmaceutical commercial, you know, you see the person taking their medications, dancing through the park, jumping around because they feel so much better. But in the background, you're getting the disclaimer saying, but you could die.
The last 10 minutes are like,
side effect may be death.
Side effects,
Yeah. And it's like
And
super
it's
sad.
pandering and marketing to the patient, bypassing the medical provider that it actually is the one that should be able to decide whether that medication is okay for the patient. So I think exposure to complications. Do you think complications, Lauren, do you think complications should be a part of the course when you take a neuromodulator or a filler or a chemical pill or a laser course?
Yeah. Because it will happen.
It's not if, it's when.
Yeah.
not if, it's when. We've been privy to some exciting times in here. We've had Dr. John come here from Australia, and he is one of the top doctors that will handle severe complications that happen to people with injectables. And so we've actually been exposed to seeing that it can be an issue. And not only that, it's not that we should stop doing these procedures. It's we need to find out how we can mitigate them, stop them. And one of those utilities I found can be helpful in getting yourself out of something that you got accidentally into, like an occlusion, is ultrasound. We've been utilizing it here a bit. Do you think that is going to be in the future, Lauren? Do you think that... I was looking at Charlotte. Do you think that's in the future of, in order to be certified as a nurse, you will have to have some form of complication certification that you can handle it through ultrasound and maybe catch a vascular occlusion or be able to mitigate it early on?
I think that if it's a resource that's available, that it should absolutely be utilized. If you can prevent any sort of complication, I think every provider should have at least some basic training in that. And I don't think that talking about complications is supposed to be used as a fear tactic. Like, I don't think that, bringing awareness to complications is supposed to say, don't inject, don't do filler, don't do Botox, don't do chemical peels or lasers. But it's to bring light to the fact that they're, like you said, it's not if, it's when, and that complications do happen, and that it's important to know how to mitigate them and have the resources on hand to be able to do that.
A community of people, maybe we're not as schooled in mitigating those or fixing those or correcting or assessing, but you need a team of people or access to ones that can help, because you owe that to your patients.
Yeah, right. And it's not just mitigating them, it's having, not only is it mitigating, but it's the prevention, which is ultrasound. You can use ultrasound for both ways, which I think is really incredible.
It is. I think it's incredible too. You three all are in this realm of aesthetics that is really, I always say it's a baby. It's really new, and it's going to soar in the next 20 years. Everyone wants Botox. Neuromodulator girls are 20-year-olds want a little of it. They're willing to spend their little paychecks on it. It's a 98% satisfaction rate on this drug. Neuromodulators have complications too. We see them. We see them in here. And whether it's lid ptosis or cheek ptosis or brow ptosis, or somebody was injected in the wrong place in the lateral area of the eye and their eye gets dry, we see these things and they're real. And the more you are schooled in anatomy, do you think that's helpful?
Yes.
In your anatomy and mentorship?
Well, everyone's anatomy is different. Like, I've noticed with every single person I've injected, the injection sites are not the same. And I think that's also so important when you do get certified, is understanding that everyone's face is different. You've taught me so much about symmetry. It doesn't have to be like 3 units on this side and 3 units on this side. It can vary based on what you're seeing, and that's why the assessment is so important too.
Very. But it's very important. Botox is not, it kind of gets, it's the entryway into being an aesthetic nurse. And one of the reasons why is because if there is a complication, it naturally will correct itself. The body will go back to baseline most likely. So the risk there is lower than, say, an injectable filler. But there is a lot to a neuromodulator injection. You can really support somebody's youth, but you can also cause other things to happen. We've talked about, and that's what we do here when we train or when we educate or mentor. I really am a proponent for y'all, you newbies out there, or you're not new and you're by yourself somewhere working, doing injectables. Get a mentor, get some shadow days. There's some great shadows, people that shadow that are high level. I've shouted out to them before: Nicola Lowry, Lori Robertson, Suzanne Rogers. Those are 3 of my favorites, and they all offer mentorship shadowing days and in office and also come to office. So I think if I could go to you guys and have you guys give your advice to anyone considering this industry. Leslie, I'll start with you. What advice would you give someone that's in this industry, thinking about getting in it? What would you have them do?
In the industry of just nursing or aesthetics?
Yeah, aesthetics.
Okay.
If they're considering it.
Mm-hmm. Well, I think the number one thing for me that I would recommend to anyone is just go into it with an open mind, because you never know what's going to come your way, and just always be ready to learn from it and use it in the future, and just be ready to learn and have a positive mindset too as well.
Good advice. Good advice. Be open-minded. I love that. Because sometimes we get kind of closed-minded. I know. I don't need to know that. I know that already.
Yeah.
So that's great. That's great advice. Okay, Charlotte, what kind of advice would you give someone that's in this industry or thinking about it?
I would say that get as much information as you can from, a reliable source. There's so many. I mean, I know that you're a clinical study junkie, and
nerdy.
And I appreciate that, because it is so important. And luckily, I like being right in the midst of school. I have those resources, which is really awesome. But I still look to other places to get resources and to learn and just absorb more information, because that's all you can really do is just keep learning and learning. And there's never enough. You can never know it all. And I think the second that someone thinks that they know it all can be pretty dangerous, especially in medicine.
There's a difference between confidence and knowing it all.
Yeah. Mm-hmm. So yeah, I would say that, to someone that might be starting out or just even interested in the field, just, listen to this podcast first off. But also just ask questions to people that you know. Because you could go on TikTok and Instagram and look up, do I want to be a nurse, and get all these different opinions from people. But what's truly important is if you know someone that's in your life that's a nurse, or someone that's even in aesthetics, that you can get true advice from someone who's had real experience in patient care. And it doesn't even have to be aesthetics, but just someone that's has that day-to-day experience with people and has a little bit more knowledge on the industry. It can be really valuable.
Yeah. Okay, Lauren. Can
you repeat the question?
Repeat the question. What advice do you have because now you're in.
I'm in.
You're working, you're building your business while you're still being a nurse, which you love doing. Mm-hmm. Well, you're always a nurse. You're a nurse whether you're in aesthetics, treating aesthetics, or you're working in ICU or wherever you're at the hospital, labor and delivery. You are always a nurse. What advice do you have for people that are considering the transition into aesthetics, or they're watching social media and they're like, I want to be a nurse so I can do aesthetics? You have advice for those people?
I think my best advice would be obviously doing your research on what it's about. And then if you've decided that that is a journey you want to do, is getting the proper education and certifications. I feel like because aesthetics is something so desirable and so many people want to do, they're taking a lot of shortcuts. or they'll go get certified, but they won't even inject, and they won't even have the feel of it injection, because it's trust me, it's not like anything. It's not like putting a sub-Q shot in someone's arm at the hospital, or or an IM. It's nothing like that. So I definitely recommend just finding the certification that you feel will kind of create a successful business for yourself. You can't take shortcuts in it. It's an evolving industry. It's always going to change. So regardless, if like I've talked to you about it, we've talked about taking more courses together. It's constantly evolving.
Yes.
Keep up with it.
You do.
So
We're going to go when you get back from her wonderful honeymoon. I'm going to take her and we're going to go take a course. We're going to go to San Diego. I mean, I'm just a junkie myself. I just got to learn more and get more connections. That's the beauty. And if you are a nurse injector or a PA, nurse practitioner, or a physician practicing, I recommend you go to build a community by going to courses. If you are alone, practicing alone with your staff on a day-to-day, you're in that hamster wheel. Get yourself out there, meet other people, take some courses, and who knows what you can share with others when you go to these courses. So this is the beginning of many of you watching's journey, what it looked like. And this is what it looks like for a lot of you that are thinking about starting. So I hope we brought our home and our personality of aesthetics to you, and you got to see a little bit about what we're all about here, and my beautiful, beautiful girls here that I can't wait. I'm hoping it's not longer than 10 years, but 10 years from now, what they're doing, I mean, they're just going to be, if they're not with me, which I'm going to try to keep them with me, but if they're not with me, I can't wait to be a part of their journey. So we have to build these young ones up that are in our world of aesthetics and get them prepared to go off and have a beautiful future in this industry responsibly. So I love you guys. And thanks for taking your Monday to be here with me and everyone else. So we've got to have our toast.
Oh, yeah.
Okay, Cameron. Cameron is our behind the scenes guy here. Come here, Cameron. He's our camera guy.
Thank you.
Thank you. Thank you. Shout out to Cameron. Thanks,
Thank
Cameron.
you so much.
Our bartender.
Our bartender here at JKH Aesthetics and the Beauty Outlaw. So I don't have to welcome these three into being an outlaw because they've already been an outlaw. They're already part of the team. So thanks, guys, for sharing your special stories, your insight with others. So this is what's going to grow this industry in a positive, responsible way. So cheer, cheer.
Thank you.
Thanks, Jerry.
You guys.
Love you.